fractures.
A break or crack in the bone is called fracture. A broken bone that does not puncture the skin is called closed fracture. But sometimes the bone can fracture the skin, and this is called open fracture. Even if you can't see any blood, the break will have caused internal bleeding, and the injured person may develop shock. Bones that are still growing like children's bones are supple and can split, crack, and bend quite easily. A bit like a twig, but the injury is still very painful. If you think someone has a fracture, you may see swelling and bruising. They may have difficulty moving and have movement in a natural direction. Their limb may look shorter, twisted, or bent. There are grating, noise, or feeling if the limb is moved. And lastly, they experience loss of strength and signs of shock. If you think you have a broken bone, support the injured part to stop it from moving. This should help ease the pain and prevent any further damage. Place padding around the injury for extra support. If it's an open fracture, cover the wound with a sterile dressing and secure it with a bandage. Apply pressure around the wound, not over the protruding bone, to control any bleeding. Call 911 for emergency help. And while waiting for help to arrive, don't move the casualty unless they're in immediate danger. Be able to support the injured area. For example, fractures on the arm can be secured against the body with a sling. A fracture to the leg can be secured within an uninjured leg with a triangular bandage. Keep checking the person for any signs of shock, but do not raise the injured leg. If necessary, raise the uninjured leg. If they become unresponsive at any point, prepare to treat an unresponsive casualty. So remember, pad and support the injured area. Use a sling or a triangular bandage to keep it secure. Be able to cover any wounds and call 911. And that's how you treat someone with a fracture.
Nosebleeds.
When someone is having a nosebleed, your priority is to control the bleeding and keep the airway open. Tell them to sit down, never lie down, and keep the nose above the heart to help to control the bleeding. Get them to lean forward and never backwards. This ensures that the blood drains out through the nose rather than at the back of the throat, which may block the airway. Ask the casualty to breathe through their mouth and pinch the soft part of the nose. You can give them a pad to catch the blood that may drain out. After 10 minutes, release the pressure and reassess. If the bleeding has not stopped, apply the pressure for further 10 minutes. If the bleeding is severe, or if you have not managed to control the bleeding after 30 minutes, it is time to call for an ambulance. So remember, get them to sit down leaning forward, pinch the soft part of the nose, and if necessary, call for an ambulance. And that is how you treat a nosebleed. Thanks for watching. Bye!